get it.
Welcome to the New Testament Church of God YouTube channel. I'm Corinne Barnes, and I'm pleased to have with us today Dr. Stephanie Fletcher-Lartey. Dr. Fletcher-Lartey is joining us from Sydney, Australia. Welcome, Dr. Lartey.
Thank you, Dr. Barnes. It's a pleasure to be here with you today.
I should point out that Dr. Fletcher-Lartey is, first of all, a child of God. She's a Christian, a member of the New Testament Church of God. She's a pastor, but she's also an epidemiologist with about 24 years experience in public health. She started her career here in Jamaica in St. Mary, but is now living and working in Sydney, Australia. Dr. Stephanie Fletcher-Lartey. Australia is a very long way from St. Mary. How did you get there and what are you doing there?
Thank you. I actually came to Australia in 2009 when I was blessed to receive a scholarship from the University of Technology, Sydney, to pursue a Doctor of Philosophy degree here. I was very blessed to have that privilege. And so while I was working as a public health inspector and regional environmental health officer in Northeast Regional Health Authority, I was fortunate to apply and successfully receive the scholarship. So I came to Australia in 2009 to undertake the PhD, which I finished in 2013. And then I decided that since I had no strings attached back home, it was in order for me to stay in Sydney. So I decided to stick around a little bit. Most people seem to want me to stay here. So I did stay back and I got my first job working in the university in the WHO Collaborating Center for Nursing, Midwifery and Health. And then after that, I went back into mainstream public health, where I worked as a public health epidemiologist for the New South Wales Ministry of Health. And I've been here ever since. And since then, last year, I was actually back in the Caribbean, working for the Caribbean Public Health Agency as an advisor on their emergency response and communicable disease. So I was actually in the Caribbean last year, all of 2020. I'm back here in Sydney since December 2020. And I am, as you see from my title, I am leading the COVID-19 study for the Burnet Institute on behalf of the government of Victoria.
So you're well placed to speak to us about COVID-19 and vaccines.
Hopefully I should be able to make a mark there.
Because that's what we want to talk about. COVID-19 and vaccines, a very topical issue. I mean, it's on everybody's mind throughout the world. It's a pandemic, so no country is prepared. So
Yes.
I really want to start, I don't know if you're in Jamaica actually when we had our first case. It was on the 10th of March, 2020.
I was in Trinidad actually because I was leading the COVID response. So my department that I headed up was the department that leads the communicable disease and emergency response. So we were very much the first people who knew. In fact, the first case was diagnosed in my institution, I believe. So we were fully aware of the first case.
Yes, I remember, I think most people remember where they were and when the announcement was made and how our lives just changed immediately.
Yeah.
And nothing has been the same since. But the vaccines have now been developed. We have, well, the United States has 3. There's Johnson & Johnson, there's Pfizer, there's Moderna. And in the Caribbean, we're more familiar with AstraZeneca because that's the one that we have been administering. But I know that there's a lot of fear and suspicion about the vaccines themselves, and particularly the AstraZeneca. Are those fears justified?
Well, what are the fears? Maybe explain a little bit more what are some of the fears that people are having about the vaccines?
Well, now, especially with some European countries, I mean, Germany, France, and some Eastern European countries, saying that some people have actually been administered the vaccine and they have developed blood clots and other illnesses. And so people are wondering, is it safe to take the vaccine? And some people are thinking the AstraZeneca is a substandard vaccine, so that's why we're getting it in the Caribbean. So there are these fears surrounding the vaccine. What would you say to those people? Are those fears justified?
All right. So essentially, this whole pandemic has been plagued with a lot of fears from day one. So I suppose the fears that we are seeing right now is a spin-off or a continuation of what has started more than a year ago with this fear mongering, I would like to call it. And people have just been on this high, like literally drunken with fear for more than a year. And so almost anything will trigger them off. Some of the things that, would not normally trigger people off are probably triggering them off now because they have been immersed in this kind of atmosphere for a long time. So with the AstraZeneca vaccine, this is the one that was created by the University of Oxford and AstraZeneca. So it is a genetically altered virus with a coronavirus protein that activates the body's immune response. And it is estimated to be about 62% effective for preventing symptomatic infections, or about 40 to 55% of illnesses when you have two doses at least 4 weeks apart. Now, these vaccines, they are much, because they have been produced using a cheaper type of technology. That is the reason why initially the cost for these vaccines are less than the others, because they're coming out to be about $10 per injection. And because they don't require that strict cold chain like the other vaccines. So for the AstraZeneca vaccine, you can keep this in your standard refrigerator for up to 6 months. So yes, it may seem inferior, but it's in truth and in fact, if you compare this with the regular childhood immunization, the vaccines that we get through that, it basically compares when it comes to the storage in terms of the refrigeration. So what we are seeing here is not different. So the fact that there might be some new types of vaccines that require this significantly cold temperature does not make the AstraZeneca vaccine inferior from that perspective. The fact that also the effectiveness is not as high as that of some of the other vaccines does not also make it inferior, because what we need to understand is that when they do these clinical trials, and maybe I should get into a little bit of details about some of that, when they do these clinical trials, they test to see how well the vaccine candidate is able to prevent illness in different types of people. But there's one unique thing that we probably did not realize, is that when the AstraZeneca vaccine was tested, that was after both Pfizer and Moderna. And as a result, the Pfizer vaccine and the Moderna vaccines were tested long before we had some of these new variants. And so they were tested on the original virus. AstraZeneca, on the other hand, came out months later after we already saw some of the new variants coming out. And what we are seeing is a better picture of how well these vaccines do against some of these newer variants. And so these vaccines were tested in, say, places like South Africa and Brazil, where we are having some of these challenges with the new variants. And so what we should realize is that this vaccine, while it is saying 62% effectiveness, it does still protect a significant proportion of the population when we put it in the context of the different variants of the virus that are in circulation. And so I don't believe that we should consider it as an inferior vaccine. And also remember that for most vaccines to work, we need something called herd immunity. So the more people in the community will become vaccinated, the better that vaccine will work. So instead, my recommendation would be, instead of yielding to these fears and worries about the vaccine, the more people who want to be vaccinated should get vaccinated so that we can have a better protection for the community. So that would be my take on it. And the last point would be in terms of the clots that people are worried about. See, most vaccines will have some kind of side effects. Um, that basically you will have some mild reactions to the vaccine, and that usually happens at the site of the injection. You know, so when people get injected, some people will have this pain or the swelling in the arm where they get this vaccine, or some people may have some fever or muscle ache and so on. But it does not mean that you know these symptoms are going to make you sick long term. For example, most people, if you've ever had, for example, a flu vaccine in each year, you will know that you will probably get a bit of soreness on the spot. And you sometimes have a little bit of, like a bit of fatigue or weariness after, but that goes away within 2 to 3 days. Now, for some people, they will have underlying, what we call underlying predispositions, or something about you that may cause you to react differently to different chemicals when they are put into your bodies. And so there are people who have reported blood clots. However, according to the World Health Organization, they have these vaccine advisory committees, and they have reviewed some of these reports on the blood clots, and they have said basically they have not seen any cause for concern. The few cases that have occurred is not essentially an indication that the vaccine is causing people to be sick. And sometimes what we need to do is to put some of these things in context. If you have 1 million people and one person gets a blood clot, does that mean we should not use the product? If did the blood clot lead to death? Some of these things we have to be quite practical and really think through, what does it really mean for me? Am I predisposed to getting blood clots? Maybe if you have a condition that predisposes you to having blood clots, it would be important then to speak with your doctor or your specialist about whether or not they think you are able to take the vaccine. So that would be my perspective on that side of the AstraZeneca vaccine.
Thank you. Another argument I've heard is that some of these vaccines, they alter your DNA. Is there any truth to that? So people are afraid because they do not want their DNA to be altered. Is there any truth to that? Or is that just another misconception?
All right. So what I know from a scientific perspective is that there are basically, let me step back a little bit. There are a few vaccines that have what we call the mRNA in it. But it might be more insightful if I basically explain a little bit about how vaccines actually work. And then that might help people to put all of this in context. All right. So when your body is infected by a germ, we call those germs a pathogen. So pathogens are germs that have the ability to cause an infection in your body. So when one of those germs get into your body's immune system is triggered. Your body's immune system is like this, the army that God has placed in your body to help you to fight off infections. So what happens when a germ gets in? The germs have something that is called an antigen, and the antigen is usually a part of the germ that basically is like a flag that says it's a signature for this germ when it gets into your body, right? Your body recognizes this signature, which is the antigen. All right. And every time you become exposed to that particular germ, your body recognizes that signature that this germ has. So your immune system then develops what we call antibodies to fight against that germ. So your immune system identifies this antigen like a signature for that germ, and it releases those soldiers that are trained to fight against those particular antigens. All right. So if you are exposed to like 10, 15, 20 different germs, each one will have its own signature, and your body will have those signature antibodies to fight against that specific germ. So when we get a vaccine, the vaccine basically does a similar approach to what your immune system would normally do naturally. All right. So your immune system will recognize the organism, and then it sends these immune soldiers to fight it off. So what we do with vaccines is that the vaccines usually contain a weakened form or an inactivated form of these germs that will cause your immune system to trigger and prepare a response so that so it is ready anytime it comes in contact with one of these organisms, then it is ready to fight. Now, some of these newer vaccines, for example, the Pfizer vaccine and the Moderna vaccine, they contain a new technology, which is like a blueprint for producing the antigen. And this blueprint is called messenger RNA, or the messenger ribonucleic acid. All right. So this is another way that the body recognizes the organism that comes into the body. So when the body recognizes the mRNA, for example, that gets inside, what it does, it has the same, basically the same response as it would have when it sees another vaccine. But what the mRNA does in particular, when the mRNA enters, so the mRNA, which is the messenger ribonucleic acid, this is what the scientists have done, is to teach this messenger to deliver a message to your body's cells that would normally cause the immune response. It delivers the message to your cell. It goes out, it goes into the cell, but it does not enter into your DNA where your body's signature is included. And that DNA that encodes your system is in the nucleus of the cell. The mRNA does not enter into the nucleus. What the mRNA does, it enters into the cell, it delivers the message, it says to the cell, I am carrying a message about coronavirus. I need you now to begin to release your soldiers to fight against this coronavirus. So what the body does, it begins to receive the message, tells the particular cells that need to be activated, okay, this is a new threat, be prepared to fight it. And so they begin to prepare their weapons, their shield and their spears to fight this intrusion that is coming in. According to what I understand about this new scientific technology, once it has dropped off the message, the cell then releases it, it becomes disintegrated, and it is no longer active in your body. So essentially, the vaccine enters a cell, but it does not enter into the part of the cell where your DNA is stored. And so it is unable to change you or to change your chemical makeup as a result of any of the messages that it brings. So that is my understanding from what I've read and I've researched about the messenger RNA. All right. So once, as I said, as the message is delivered to the cell then builds up that immune response, produces the antibodies that are needed, and then the mRNA goes away and it is rendered ineffective by the body. So from that perspective, that is really how I would encourage people to understand that from what we understand currently, based on our current scientific knowledge, there is no interference between the messenger RNA and your DNA.
So Christians need not fear that, man is trying to play God and, developing these things to interfere with the chemical makeup of the body. That's what you're saying. Christians need not.
Look, essentially, God has given us the ability as scientists to do many things. Remember, in the book of Genesis, the Lord said to Adam, you must have dominion over the earth. And one of the ways in which we do have dominion is through science. Science is one of the biggest expressions of man's dominion on earth. It is a way in which we express our God-likeness, our ability to create and to invent things is a significant example of the the part of God that remains in us, because God has given us the ability to create things. Can you imagine if we didn't have science and all these things? What would have happened to the world? So God has equipped us with the knowledge and the skills. Yes, there are people out there who are doing things with a negative attitude, or with some kind of harmful mindset behind it. But personally speaking, from a public health perspective, what we do understand is that vaccines are here to protect us. And God forbid if somebody should try to use that as a platform to advance their evil ideologies, then as a church we have a responsibility then to pray against that. But I personally do not believe that this, based on the scientific evidence that is presented, that this vaccine is going to change our DNA. So current science, I don't have that level of understanding that that is going to happen.
Okay, thank you. Another perhaps misconception or fear I've heard is that people are a little bit doubtful about the efficacy of the vaccines. I mean, you have touched on that, but because of the speed with which it was developed, I mean, we have heard in the past that vaccines take like 10 years to develop, and this one has taken a year. So people are a little bit concerned about that, the shortness of the time. How do you address that? How do you speak to that?
Yes, and I think it's fine for people to have those, and to be concerned. Many people have been concerned. Some of us, even many of us as scientists, have been concerned too. But when we step back and look at it, to be able to answer you, I think it's important to look at what usually happens when we develop a vaccine. So traditionally, it would take about 10 years to go through all the various phases of a vaccine development. It usually starts off with what we call preclinical studies. And then in those preclinical studies, researchers test their product on animals to see whether this product is able to produce an immune response. Same thing that I described just now. Is this happening in animals? And then they also test to see whether it has any safety issues in the animals. So those are called the preclinical studies. Once they are reasonably satisfied that it does seem to produce it does produce an immune response and it is relatively safe, they will then move on to test this product in a phase 1 clinical trial, where they are now moving it to a very small group of healthy adult volunteers. And they're basically testing whether the vaccine is safe to use in people. All right. After they've done that with a smaller group of healthy individuals, and they are satisfied that there are no issues around safety, they will then move this to what we call the phase 2 trials. In the phase 2 trial, the vaccine is now given to different people. So, different vaccines, as we were speaking about the clots just now, they want to give this vaccine to a variety of people. These are the people who would most likely be impacted by the disease, or those who are more at risk of catching the disease, those at risk of having severe outcomes, or people who are more likely to die from having the disease. So they based on what we do, that's what people like us do. We are epidemiologists. So we study the disease and we get to identify who these people might be. So for example, with COVID-19, we know that people who have certain chronic conditions like diabetes, cancer, high blood pressure, and some of those conditions, they are at higher risk of severe outcomes from COVID. And so some of these phase 2 trials will look at some of these people, but we also know that people have certain ethnic groups, certain minority groups, you might be of a certain age. So what they do is to select people based on what the epidemiology, what the evidence is saying, and they test the vaccine in a group of those people, because it would be important to understand how well this vaccine works in those groups of people. So once they've done that, they also check also to see whether the vaccine is effective in protecting these people against the disease. They also check to see whether there are any safety issues. They look at side effects. They look at, whether the vaccine reduces the number of people who get sick. They may want to know how many doses of this vaccine is needed to make people to be effective. And they also look at any side effects that might happen in people. So once they have done this level of phase 2 trials, they will go on then to take it to the next step if they have the confidence that it does protect people and it is safe to use in humans. This then goes on to the phase 3 clinical trials. Many of us might be a little bit more familiar with those because a lot of the results that we have been seeing, for example, for the 4 vaccines that have been approved in the US, these results are based on the phase 3 clinical trials. Now, in the phase 3 clinical trials, they roll out this vaccine to a large number of people, thousands of people. And in the case of the COVID vaccines, you will see that sometimes 35, 40, 50,000 people have been tested to measure whether it is effective and whether it is safe, and also to see whether the vaccine does protect a larger group of people. So, and they also, in these phase 3 clinical trials, will include some of those at-risk people as well to ensure that they are doing it in as real life as possible, a scenario. So they get larger numbers to kind of replicate what would normally happen if you were going to roll this out to the community at large. And then, of course, then they will do post-market surveillance, and sometimes they have what you call human challenge studies, which is not really very common. All of this process usually happens. Each phase of these clinical trials usually happen one by one. So they will run the scientific lab experience in the animals. Then after those results come out, they will do the other part. What has happened with the magnitude of the COVID-19 pandemic and the widespread nature, as you know, up to earlier this morning when I checked the statistics, we are at 120 million cases. That's mind-boggling, even for me as an epidemiologist.
Indeed, indeed.
So what happened was, by this time last year, nearly every country in the world, so on the 17th of March, by this time, several countries in the Caribbean, which was the last region to be infected, had cases. And then on the 11th of March, the WHO declared it a pandemic, right? So based on the magnitude and the impact, based on the numbers of people who were getting sick, the speed at which people were getting sick, I think it became very clear to people around the world that this is not going away immediately. And so we need to come together. So what happened is many corporations, many governments came together and they put money. They paid these vaccine development countries up front. That does not normally happen because when you are developing vaccines, each stage requires money, and most people are not willing to put money into that upfront. It's a very risky business, and in many cases, those vaccines, they never ever come to anything. The vast majority of those chemicals or those experiments, they come to a point and they abandon them. And it's a very expensive process. So what has happened with COVID? Early on, different corporations, governments, different groups of people around the world recognize that we are going to need a vaccine. And so what they did, they basically underwrote the risk. So they said, we are going to put money on this. We know some of these trials are going to fail, but what we will do, we will pump enough money in it to make sure that the one that comes out on top is able to go forward. So what this was able to do was to eliminate those problems that we usually have when we are developing these vaccines that requires money at every step. So that in that case, they were able to run some of the steps concurrently. So they were able to basically overlap some of these steps. So they have combined basically phase 1 and phase 2 trials. So while they were doing the animal studies, and basically a lot of these vaccine candidates, they were already in development way before the pandemic. Because if you recall, we had similar coronaviruses before. We had the Middle East respiratory syndrome coronavirus, and we also had the severe acute respiratory syndrome coronavirus 1, which we also had cases like in 2000, early 2000, 2002. They already had basically the building blocks to start some of these experiments. So they were already experimenting with some of these coronaviruses. right? And some of these new technologies like the mRNA, they were already experimenting with that for Zika and chikungunya and certain cancers. So what happened was they already knew what some of these technologies could do. So the moment the money was pumped in, they were able to jump quickly and begin to, expedite. They were able to push forward very quickly with finishing up some of these experiments. So because we are in a pandemic, there are certain things that were happening parallel. So they did not cut corners according to the reports that we have read. And what we need to understand also that there are bodies, there are organizations that are tasked with monitoring these processes. You can't just go off and develop a vaccine and give it to people. It goes through rigorous testing. For example, I live here in Australia, and in February, Australia started our vaccine rollout campaign. What happened was the Therapeutic Goods Administration, which is the body in Australia that does the evaluation of new medicines and products and tests, like biomedical stuff, they already received samples of these vaccines. They send it to our labs here, and our scientists have tested to make sure that these vaccines are safe and that they are useful for our population. Before they roll it out, before they give it to anyone, they've already taken it to our labs and they go through that scientific process to test it. This may not necessarily happen in every country, but outside of countries like Australia that may have the capacity to do that, there are other mechanisms in place to do that. So they also monitor it, they monitor the safety side of stuff. So this is the reason why they have been able to basically expedite. So when the SARS-CoV-2 genome, which is the virus that caused COVID, when that genome was first identified, the Chinese government shared that with the World Health Organization. And what that did was enabled them to share that with different laboratories across the world for them to start developing this process. And so that is the reason why they have been able to overlap some of the steps, because there was some back work that was already done. And so they streamlined and shortened that approval process. But the duration of the trials was not shortened. So if you read all the reports about each of the individual trials that were done for all the vaccines that have been approved, you will see that that part, it usually goes for a couple months in that large group of people. And that process was not shortened. So the safety side of it was not tampered with, because they had to make sure that it was safe for people. And so that's why they had these large numbers of people to make sure that they were testing it in an appropriately, appropriate size population to reflect the general population. I know that is a very long-winded answer, but I'm not sure I could answer that in any shorter than that, just especially for lay people.
Not at all. You had to put it in perspective. So thank you for the reassurance that the fact that it was developed so quickly within a year doesn't mean that they cut corners, and so the vaccine is not as safe and as efficacious as any other vaccine that would have been developed in 10 years. So thank you for debunking that. So there's another argument that I'm hearing, though. There are some people feel that, they're healthy, so they take their vitamins, they eat well, and they exercise, and so their immune systems are strong. So these people are arguing that there's no need for them to take the vaccines. How do you respond to those people?
Wow. So my response would be to say vaccines are for everyone. It's not about whether your immune system is strong or not. The principle on which vaccine work is when enough people in the community are vaccinated against a disease, the ability for this disease to spread is limited. And so, healthy or unhealthy, the principle that underpins the effectiveness of how vaccines work in your community is when we have enough people vaccinated. So yes, I am healthy and strong, and I didn't catch COVID because I was exposed to it many times, and thank God I have not had it. However, when we are vaccinated, or you have enough people in the community who is immune to the disease, it slows down the spread of the disease. or it limits the spread of the disease. And we call this herd immunity. So because the disease slows down or it stops the spread, it also protects those people in our community who, for whatever reason, are unable to take a vaccine. There might be some people in our communities who are immunocompromised or something is wrong with their immune system that prevents them from, from being able to produce those little soldiers that we spoke about earlier. Those people may have something wrong with that process in their body that causes them to produce the soldiers. And so if they are exposed to, say, COVID, they might not be able to come up with that same immune response that you and I, or those very healthy people, are able to. So what happens when we take a vaccine, and this applies to any vaccine, not just COVID, when we become vaccinated, like we did when we were children going to school, what we do is to protect some of those people. We protect those people. So what we do,
it's a selfless act.
It's a selfless act.
And that's
It's a community act. It's a community act. And that is really part of our responsibility to help those who cannot help themselves. So yes, if you are healthy and strong and you think that your immune system is working well, you are the people who actually need to take the vaccine, to become vaccinated against a disease, because what you are doing is protecting those in our communities who cannot take the vaccine for various reasons. For example, let me make this practical for you. With everybody's familiar with measles, right? With measles vaccines, children under the age of 12 months is not recommended to take a measles vaccine because it is a live vaccine. And so when the vaccine is live, it means the virus is there and it has the ability to cause disease. It might have some, it may cause disease in the person who has it. So your immune system is not built up enough to be able to make those antibodies. However, when the parents and everyone in the family and the community becomes vaccinated, we protect them. If you look throughout Jamaica or the entire Caribbean region, it is very almost unheard of for someone to have measles. And the reason for that is all of us were vaccinated when we were children. And most of our parents, they had caught measles naturally. So they have what we call natural immunity. And those parents who have natural immunity, they didn't need to get a vaccine. But we, the children, we got the vaccine. And so now we protect all the other people, all the young babies who are born in our community. They are protected until they are able to get their vaccine. This is what has been happening over the years with measles, mumps, and rubella. Polio, for example, we got that little drop under our tongue. That is what happens. We have been able to eradicate diseases like polio because everyone in the community is vaccinated. And that small handful of people who cannot be vaccinated for whatever reason, they are protected by the rest of us because we cannot give it to them. We cannot catch it, and so we cannot give it to them. So the more people in the community who are vaccinated, the less likely it is for you to come in contact with someone who has a disease and to pass it on. So this is a principle in which vaccines work on a community-based level. And so my encouragement would be to think from a community perspective. I am doing something for the greater good of my community and to protect those in my community who might not be able to mount an immune response or naturally, or to be able to take a vaccine because of various different reasons. I do hope that has, helped to outline that a little bit more.
Indeed, and Christians are selfless people, aren't we?
Yes.
We are selfless people.
That is definitely what I believe.
Yes. No, I want to, you're also a pastor. Not sure if I mentioned that in your introduction, but you're also a pastor. You wear many hats, don't you?
I do wear many hats.
Yes. So I want to tackle a big question now, and one that I've heard within the Christian community. It's the whole issue of the vaccine being the mark of the beast. So there's this argument that, Christians should not take the vaccine because here you go now, some countries are talking about you need to get your vaccine passport And if you don't have the vaccine passport, you won't be able to travel. So it is the mark of the beast. And so we should not take it as Christians, because the Bible talks about the mark of the beast in Revelation. How do you respond to that? Is the vaccine
Wow.
the mark of the beast?
I personally do not believe that it is the mark of the beast. And the reason why I don't believe so is because the Bible does clearly outline various things about the mark of the beast. All right. So for example, if we maybe to make this realistic, we can go to the scriptures. Yeah, because as believers, you know, we like to hear what the Bible says. So essentially, the Bible says in Revelation chapter 13 that we read that the beast from the sea has a number, which is the number 666. And we were told it's a human number or the number of a man. And we were also told that people in Revelation have to either receive this mark on their right hand or on their forehead if they want to engage in commerce, if they want to buy or sell. All right. Now, based on my understanding of the vaccine, I don't believe this is the mark of the beast. And the reason why I say this is that there are certain things that must be in place before the mark of the beast comes, based on my understanding of the word of God. So essentially, I believe the tribulation must come. The first one must come first. And that is going to be the launching pad for people to receive the mark of the beast, because it's going to be a system that sets up so people cannot trade, they cannot invest. From a public health perspective, this whole idea of vaccine passports, let me link that to what we are saying about the mark of the beast. It is very likely that the COVID vaccines will become mandatory for people to travel to many countries. And in some countries, like in Israel, they've already implemented some kind of vaccine passport. Here in Australia, we have a registration system for anyone who receives any vaccines. And what we are doing is we are doing the same thing that we would have done with any vaccine. So you register. So I, Stephanie, you know, once you receive the vaccine, the nurses or the doctors who delivered that, they register that you have received the vaccine. They would have done that when I had my flu vaccine last year as well. And they would have done that when I had my whooping cough vaccine when I was pregnant. So that's a system that is in place. And that is, generally speaking, in many countries, that is what happens. In Jamaica, what we get is a little card that says you have received this vaccine. I still have my card, my little blue immunization card that Nurse Fergus signed when I was leaving Jamaica. I still have my piece of paper. Now, what we also know is that already we are familiar with certain vaccines that you need to travel. For example, I have a second card that is called a yellow fever vaccination card. Because as you might well imagine, I travel quite a bit. And the first time I got that yellow fever vaccination card, I was going to Trinidad to work. And in Trinidad, there is a disease called yellow fever that is transmitted by the same mosquito that transmits dengue. They have that mosquito there, and they have this virus in the monkeys in the wild. So whenever you are going there to work, you will be asked to get this yellow fever vaccine because of the risk of catching yellow fever. I personally believe that that system is something that may come into effect for COVID based on a lot of the things I've been seeing on the internet. Many countries are having this kind of discussion at a national level. So currently, most countries require that yellow fever vaccination card for traveling, in keeping with what we call the international health regulations, as a means of part of their system to protect their country from disease coming in, but also to protect other countries from the disease going out. So many countries, if you're traveling, for example, if somebody from Trinidad is traveling to Australia, they will have to produce that card. Or if I'm going from Australia to Ghana, then I have to produce my yellow fever vaccination card, because it's part of their system, their international health regulation system at their borders. All right. So it is likely that some countries will begin to require that. And already Some airlines have already said that they will require it. However, how do I link this now? The point I am making is that we already have these systems in place where people require a vaccination card for certain kinds of diseases before you travel as part of an international health regulation system that they are obligated to maintain and protect the borders of their countries. Whether I agree with it or not, that's a whole different story. But I am aware that there are various companies, including big companies like IBM, and they're working with some very small organizations that are into these technologies, that are already developing technologies for vaccine passports. It is possible that it may boil down to that card like the one I have for the yellow fever vaccine, or some people may think they will have something on their smartphone that they can tap and show. But many people don't have smartphones, so they might revert to maybe something like a card, like a credit card that you can show and they swipe that. Now, experts already believe that a variety of applications that can work with each other will be in use by early this year. And in some countries already, I've told you, Israel has already implemented something. In some countries, though, they are requiring for people to show proof of vaccination before they can enter clubs and pubs and certain marketplaces. Now, does that reflect what the Bible says about your ability to buy or sell? I don't think so. It's not the same thing. My perspective from a Christian worldview is that when the mark of the beast comes, and this is my opinion as a believer, as a theologian, I believe that what will happen when the mark of the beast comes, you will be forced to take it, number one. If you don't take it, it means that there will be severe consequences, not just because you can't board a plane. Many people will never go on a plane for the year. So that is part of the reasoning why I think this is now. Now, if they tell me tomorrow that if you don't get this vaccine and you won't be able to go to the supermarket, you won't be able to send your children to school, you cannot get on the bus, you cannot go to the doctor, then that's a different story. I believe that when the mark of the beast comes in the context in which we live, and remember, we have to extrapolate this from 2,000 years ago document to the reality of where we live. If they tell you that you have to get this and you must get it in your forehead, in your forearm, and you need to have evidence in your skin that you have received it, that you have to show me that, then that for me would be more of an indication that this is the mark of the beast. But right now, I don't see that happening. And I don't believe the fact that we might be required to present a card that we have been vaccinated equates, or it doesn't match up with the fact that this is, I don't believe so. So that would be my take from a Christian perspective. And as a pastor, as a leader in my community, I believe that I have a responsibility to give that opinion on that matter.
Thank you. Thank you so much. It certainly sounds as if it's coming from a position of information. So thank you so much for that. And you put on your pastor cap there right now. So I'm grateful for that. But I was just wondering, as you were talking about this and other areas that you have actually looked at, is there anybody who should not be taking the vaccine?
Yes. So let me start by saying, if anyone is concerned about their health and whether or not they're not sure, firstly, I want to say, ask your doctor, your family doctor, or your specialist if you have certain conditions before you take any new medicine, and including a vaccine. All right? So based on the evidence that we currently have, there are certain people with certain health conditions that have been excluded from vaccination with the COVID vaccines in order to avoid any possible adverse or negative outcomes. And these are this is the information that has been published by the vaccine producers. So there are two groups mainly that have been told you should not take these vaccines, especially the Pfizer and the Moderna vaccine. This is the information that I have. If you have a history of severe allergic reaction to any ingredient that is contained in the COVID-19 vaccine, you should not take it. And I believe that I shouldn't just stop there. How do I know what are the ingredients in the vaccine? Ask them. Or you can go on the internet and you go to each of these companies and you find the detail about what is in the vaccine. Another way that you can look at this is for those vaccines that have been approved by the FDA, or if you're in Australia or whichever country, if your country has approved any of these vaccines, your country will have some kind of statement that they have published about the vaccine. That should give you the ingredients of the vaccine. So you can read that. And, you know, for example, the vaccine may contain something like alum. If you are allergic to alum, you know, if you see alum as an ingredient, then you know, if you already have a history of some severe allergic reaction to any of these ingredients, then do not take the vaccine. The second group of people are those who are currently sick and have symptoms of COVID, right? I was listening to a group of physicians earlier this week on Clubhouse, and these are internal medicine specialists, people who are actually involved in running the vaccine trials. And one of the interesting things one of them said was that if you have resolved your symptoms of COVID, especially people in countries where you do not have an abundance of the vaccine, like Jamaica, they are saying that if you already get over your symptoms of the COVID illness, then you can take the vaccine as soon as you can. But let me just qualify that a little bit too, before I run along. When people are naturally infected, so people catch the COVID, your body will most likely develop that immunity. And if you were listening when we started the conversation, then you would remember I spoke about the immunity process, the natural immunity. What they have found out so far is that, you know, we've only been in this thing for just about a year or so now. What they have found is that for some people, that natural immunity doesn't last very long. So about 6 to 9 months is what they have said so far. But I suppose in a couple of weeks, we will know more, because we will have at least about a year of data to tell us, is this immunity lasting up to 12 months? Because we have had people who've had it now for more than 12 months. But based on the current data, they saw that for some people, the immunity dropped off after 6 months, right? So what some countries are saying is that you can wait till up to 6 months and then you can get vaccinated after. Some people are saying you can wait up to 9 months. For some people, however, like what the data is showing, that a lot of people who had that asymptomatic infection, for a few of those people, an asymptomatic infection is people who got the COVID, but they didn't have any sickness. They didn't look sick. They didn't have any symptoms at all. For some of those people, the immunity doesn't last long. And so if you find yourself in those, as one of those people who have had COVID, you didn't have symptoms, you may want to be among the people who take the vaccines, because you are not too sure whether your body actually developed the immunity on its own. So that would be my recommendation. Yeah. But what is happening now, that there is more research happening, even as they are rolling out the vaccines in many countries, they are collecting that data on how long this immunity is lasting and who might be the people who need to prioritize taking this vaccine. All right. Now, for people like pregnant people, that is one question that we sometimes get. We basically encourage, persons who are pregnant to see their doctors first. All right, because we do not know. What happened is that most of these companies, they did not test it specifically in pregnant people, and so many countries are saying the benefits for pregnant people though outweigh the risk, right? So based on what we know currently about the vaccine, there is really no reason why they should not take the vaccine according to the data that we have available. And if you notice, I keep saying according to the data that we have available, because unlike, say, measles or cholera or typhoid or polio, we've got years of experience working with those diseases. And so we understand what may happen and what may not happen. And we've got so much data for a longer period of time to understand how these diseases behave, what happens long term in your body. It's only been just under about 15 months since we encountered this beast COVID. And so we are learning about it as we go along. So I do qualify my statements to say that based on our current understanding, there is really no issue that says you shouldn't take it if you are pregnant, because what most of the clinicians and the scientists are saying, that because COVID tend to have a more serious outcome in pregnant women, it's probably the risk of taking the vaccine is probably less than getting. It's better you take the vaccine than getting the natural infection, because a natural infection may have a more severe outcome. All right. And so for people who are afraid of taking the mRNA vaccines, for example, my opinion would be, if you have the opportunity to take a vaccine like AstraZeneca, then you probably should put your mind at ease, because that is the natural way that we would normally take a vaccine anyway. All right. So for the Jamaican audience who are a little bit skeptic, you're not too sure about the mRNA vaccines, then you probably have the best choice right now to go for the one that doesn't have the mRNA. So that might put your mind at ease. All right. So in terms of that, and as I said, people who have had severe allergies, and maybe if I could just add a quick point, Corinne, people who have had severe allergic reaction to other ingredients, if you've had a severe allergic reaction to any of the ingredients in the Pfizer or the Moderna vaccine, you should not take the vaccine. That is clear, and this is documented in their portfolio. Now, however, if you are allergic to peanut or bee's sting or to latex, it does not mean you cannot get it. So if you have a severe allergic reaction to like latex, or if to certain insects or to nuts or other foods, this does not exclude you from taking the vaccine. It's different. So the allergic reaction we're talking about is to specific ingredients contained in the vaccines. So that is the recommendation, right?
Yes.
So those with a history of, for example, of anaphylaxis to any injections. So some people, some people might get into what you call anaphylaxis, or they have an anaphylactic reaction, right? You may have had that in response to another vaccine in the past.
Are you going to explain that term?
Yes. So anaphylaxis is where the body kind of goes into shock because of the production of adrenaline. It's like your body goes into overdrive as a result of the vaccine or a certain component of the vaccine. So many people will remember this from when back in the days when we used to give the penicillin injections in hospital, like people who have rheumatic fever, they used to come in to get their penicillin shot. And I have actually seen someone going to anaphylactic shock. What happens though, every single clinic that gives, any clinic that is certified to give a vaccine, wherever you are on planet Earth, they usually have something called adrenaline in their clinic. It's here where I work in our clinics. It's a must. You have to have that on hand, right? So the anaphylaxis basically almost just like when you get a bee sting, if you're allergic to it or you're allergic to certain food and you begin to have that type, that you feel clammy and like you're fainting. Yeah. So the adrenaline helps to resuscitate that person, and that person would normally be attended to by someone who is trained to administer that, and then they would basically take them off just to the hospital just for them to check them over. All right. So every clinic that is administering vaccines or any kind of injections like those, they usually have the adrenaline on hand to give to that person. So if you are worried about that, then when you get to your vaccination clinic, you can just double check. It would be in order for you to ask that question. And I don't believe anybody should be rude enough to ask you, why do you ask that question? Because it is important for your health. So you can check with them, say, I would like to come in to get my vaccine. I have had an anaphylactic reaction in the past to something. I just wanted to check if you have this in place before I come down, or can you direct me to a clinic that has that? All right. But I believe that the clinics in Jamaica should have the adrenaline on hand. All right. So hopefully that's clear. I'm happy if there's if you want to follow up on anything I've said.
It's absolutely clear. And I'm sure that it has also clarified certain concerns within our community and, outside of our community. But as we enter the closing moments of this conversation, I wonder if there's any final words that you'd like to say to the Christian community and beyond?
Yes. Thank you, Corinne. And I must say, I really appreciate the privilege to just share some of my scientific views and also some of my own opinions on this issue of vaccines. I am mindful that there are many people who are confused about these vaccines. I too had concerns initially when we were quite uncertain about what's happening, what's in these things. And what I have done is to do my research. And so the first thing I want to encourage people to do is don't just sit down and listen to every single YouTube video that you have seen. Don't just listen to every quack on the corner. It's best to do research and get information from a reputable source. And some of those reputable sources are your local Ministry of Health. For example, in the Caribbean, there's a Caribbean Public Health Agency. And I know for a fact that a lot of work has gone in through CARFA to produce reliable information and to keep people up to date. I worked there for an entire year last year, writing the policies and the protocols that guides, COVID-19 response. But if I may speak to the Christians who might be watching now, or if you are concerned from a Christian or biblical perspective or faith-based perspective, I want to remind us that we have a right to ask questions about any kind of medical intervention. There's nothing wrong with that. There's absolutely everything right with us having questions. As people of faith, we are the conscience of our community, and it is okay to ask questions about any new interventions or medical interventions. All right? No, I do not believe there's anything morally wrong in accepting a vaccine. Now, some of the concerns that people have are around the fact that some of these vaccines contains certain kind of cells that were used in old experiments. And for example, this baby that was aborted 40 years ago, and they've used the same cell line from this aborted fetus. So basically, these fetus was the cells were used, but what they're using now is not those original cells. It's the replicated cells that they use. They call it a cell line. And so the cells from that original baby is not what is entering your system. It is the virus that was grown in that cell that they are giving to you, not the cell. All right? Because that is one of the other things that I've heard. But I believe that people of faith, we need to weigh in on the discussion, but we also have to weigh up our responsibility to be our brother's keeper. As I said earlier on, vaccines only work when enough people in the community are vaccinated. And so if you are not having a moral issue, or you're not having an issue that impacts upon your faith, there's nothing that should prevent you from becoming vaccinated. And I do hope that this conversation we've had here today has helped to explain some of the moral and the more religious side of things, right? It is also important that we remember that we have a responsibility to our community. Our community looks up to us to know, for direction when it comes to some of the things that we do. And so we must take that opportunity to be our brother's keeper. We must take that opportunity to essentially lead the response, right? We must understand that we have a responsibility to our community to ask the right questions and also to lead from in front. So what I would like to encourage people to do, as I said, get your information from the right sources and share, for example, whatever platform this might be streaming on, share this information with people so they can get some more details. Because a lot of times, according to the word of God, my people perish because of lack of knowledge. And I see that some people, they just go down every little rabbit hole following information. They become confused, and that encourages the fear. So today we are going to fight our fear with our faith, and we are going to trust God that these interventions that have been prepared is for our good, and that we will also trust God that if there's something wrong, if there's something that goes against what He has in store for us, then He will show us. And so we will have the mind of Christ will inform our response as Christian believers. So with that, I want to just leave it at that for today, and just thank you so much for this privilege to share my thoughts.
Dr. Stephanie Fletcher-Lartey, pastor, child of God, epidemiologist, researcher, you have been wonderful.
Yes, God.
Thank you for all the information that I'm sure will be of benefit to many people. Thank you. Look forward
Thank
to
you, Karine. Thank you so much. One thing you forgot to tell them also that I'm a singer, and they can check out my music as well on my YouTube channel.
So we just Google you and find your music.
Yes, my music is on any platform: Spotify, Apple, Pandora, iHeartRadio. I also have a YouTube channel, Stephanie Fletcher, Stephanie Jewels Fletcher, and all my music is up there as well.
We'll have to have you on again singing for us. Let's do
By
that.
all means, it would be my pleasure.
Thank you. God bless you.
God bless you too, and thanks for having me.
Bye.